Hi, everyone. I'm Jennifer Blevin Smith with Be Your Own Patient Advocate, and today we're going to talk about the benefits of using patient portals. Patient portals is a growing trend. They've been around for probably 10 years or so when EMRs were really starting to get a push in healthcare. However, they are becoming more and more important in patient care. And I want to explain to you, coming from the professional healthcare side, why they can be so beneficial to you as a patient, and as a patient, how you can use them to your benefit. Patient portals are electronic. Usually, you have to have a separate login and password to access them. However, a lot of them are offered by EMR companies that your provider doctor's office uses. So, if you go to multiple different private practices, chances are you probably have multiple different patient portals because they all use different ones. If you are in a large hospital system in the area, chances are everything could be in one place because they all use what's called Epic. A lot of it is called, I believe the patient site is My Chart. I think that's what it's called. But you might not be able to cross see things. So, like in Portland, we have a legacy hospital system and doctor's offices. We have a Providence, we have a Kaiser. Kaiser is an HMO system. Everything is together in one portal, no matter who you see. But Providence and Legacy are PPOs. And so if I have a doctor at Legacy, which I do, I have one patient portal through My Chart. And then when I see a provider through the Providence system, they have a My Chart, but they don't talk to each other necessarily. I can't see the information from the two doctors. So I have two different logins. So that can be a little bit of a pain to track all of your different logins, and I understand that. But I feel like in general, the population is getting better at tracking logins and different portals and passwords and usernames because so many parts of life involve them, right? You can pay your bills through the utilities on there. So you have your power, your water, your garbage, three different systems, probably three different logins, things like that. To keep things simple, if unless there's specific requirements, I would try to keep the usernames and passwords the same for both, so it makes it a little bit easier. However, keeping them written down in a safe, secure spot is always a good suggestion. I know I have to do that myself, but making sure it's secured so people can't get to it is the key to that. Doctors' offices love using patient portals for multiple reasons, and a lot of it has to do with patients, such as yourself, ease of access of getting information about their care, but also just the compliance side. It seems like, and statistically, patients are more likely to communicate with their doctor's offices and pay their bills and things like that if they have a means that is electronic to do it anytime that it's convenient for them. The patient portals are available 24/7. So you don't have to worry about, oh my gosh, is the doctor's office open still? I just got off work. I need to make a call, yada, yada. No, you don't have to do that. You can get on your portal. You can check your balances. You can pay your balances. You can check your chart. You can see if results have come in for labs or imaging. You can look at your last chart note. If you can't remember what the doctor recommended or what was said, you can review that and go, oh, yeah, that's right. I need to do that still. If you have upcoming appointments and you can't remember the day or time, you'd be able to view that. It's a very, very handy tool. And the doctor's offices are very much hoping that patients get more used to using the patient portals because it's more cost effective for them. They can use automation to be able to send out reminders for appointments. They can send reminders for anything that's needed, honestly, most of the time. They can send out links for you to pay your bills. And it's just able to allow them to not only make it convenient for you, but it's also going to help them be more efficient and more cost effective. And the more cost effective things are for them, the better it is for you. Also, it allows the staff to have more time to focus on the things that they really need to and make patient care more of a priority than administrative things. And those are some perspectives that I can provide coming from the healthcare side that patient portals is very nice, and I can answer questions and emails from patients in between rooming patients or at the end of the day or before I go to lunch, because it's a lot easier for me to type up a message and send it than to try to get on the phone, wait for you to answer. If you don't answer, we're in phone tag now. I leave a message, then you call back again at some point, but I'm busy with a patient, and then I have to find time to call you back. And it's very, very tough, especially with how busy everyone's lives are. So being able to electronically communicate with a patient, whether it's about you need an appointment because we just refilled your last levothyroxine until you get your thyroid labs done, or we're closed for the day because of inclement weather, or we lost power, or something like that. Really trying to use electronic means is also a safety thing, right? Like I said, if something happened at the office or there's bad weather, inclement weather, or power was lost, they can get a hold of you very quickly, and you don't have to waste your time trying to get there for your appointment and be upset when nobody's there and they tried to contact you. There are so many benefits from a patient side too, right? Like, oh, I forgot I have to pay this bill. It's past due. I feel really bad. Oh, wait, I can log onto the portal and I can just pay it right now. Things like that. You can check your messages from your medical staff if you sent something, and you can check it faster, probably in between your work day of things, instead of trying to find time to call the office to request something. It's easier just to be able to boom boom boom. Sometimes you're able to even communicate with your doctor directly a lot easier than trying to get them on the phone. I know that is a benefit for a lot of people. I can't tell you that there are more cons than pros, honestly. Some cons are even hard for me to think of. One of the cons might be not hearing a person's voice and not having that personal touch. A con might be needing to talk to somebody and having a hard time getting a hold of somebody. But other than that, the pros definitely, in my opinion, from both the healthcare professional side and the patient side, outweigh the cons of utilizing patient portals when it comes to healthcare. They're just becoming so much more efficient. They're becoming easier to use for a lot of end users like yourself as a patient. Technology is really helping with that. Now, with AI coming into this, it's going to make things a lot easier, especially for people who maybe English isn't your first language, and being able to get things to be interpreted into your primary language is going to be huge, I think. I think that we are just seeing kind of the tip of the iceberg when it comes to what technology is going to be offering to patients in healthcare. And that patient portal piece is huge. So if you haven't started using a patient portal yet, but you know that your office does offer it, I encourage you to at least sign up and log in and see how you like it. See how it's used by your doctor's office. See if you can pay your bills, if you can see your past appointments, if you can see your lab results, if you can print them in case you need to take it to a specialist, and you're not sure if your primary care forwarded it, you could log in, print it yourself, and take it with you. Or when you're at another doctor's office, you can log into your portal and show them. I've done that too. It comes in very handy. So just give it a try. I know some people are still on the fence about it, or they want that handwritten letter, they want that personal phone call, and that is completely fine. But you could also utilize your portal for other things. It doesn't have to be either or. You could do a combination. So give it a try. If you're not sure if your doctor's office offers a patient portal, ask them. They will be happy to let you know if they do or do not. They probably, when you speak to them, can initiate, if they do have one, a welcome email to you to set up your account, or they can set it up for you in person while you're there or over the phone. It's definitely worth asking. Another follow-up question about that, if they do use a portal, ask them what you can do as a patient and what you can expect from the doctor's office in using the portal, so that those expectations are there and you can ask any follow-up questions, because usually staff are usually very encouraged and excited when patients are asking about the patient portal and they want to help. Definitely ask. If you have any questions or comments about this topic, I would love to hear from you. So please leave that in the comments below. I'm here to help you. I'm here to listen to you. I'm here to help empower you with anything that you have questions about that's healthcare related, that you're just not sure about, or you want to know more about. Hit me up. I'm here for you. I'm happy to help. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all of your family and friends who you feel this information would benefit. If you haven't yet, please check out my other topics that I have created patient-centric videos on as well. Thank you so much for the support, and we'll see you next time. Bye-bye.